Afternoon, ladies and gentlemen, welcome. Jim Yong Kim, Philippe Leroux, World Bank Group, Regional Vice Presidents and colleagues. Welcome to our Spring Meetings event, Innovations to Prevent Gender-Based Violence, Building Evidence for Effective Solutions. In a brief moment, President Kim and Philippe will be providing opening remarks. My name is Alessandra Guedes. I'm the Regional Advisor on Family Violence at the Pan American Health Organization, and I'm also the co-chair of the Sexual Violence Research Initiative, which is co-sponsoring today's event with the World Bank Group. The Sexual Violence Research Initiative is a global research network dedicated to building and disseminating the evidence to improve our availability to prevent and respond to gender-based violence in low and middle-income settings, where the burden of such violence is greatest, but the evidence base weakest. Today, I am also your MC and moderator, so you can see that I'm wearing multiple hats. Gender violence is a human rights violation, a public health problem, and a barrier to solving global challenges such as poverty, HIV/AIDS, and inequalities. Our knowledge regarding how to prevent gender violence is growing, but research investments in this field are still vastly inadequate given the magnitude of the problem. But the good news is that jointly we can prevent gender violence, and that is the reason why we're here today. The Sexual Violence Research Initiative and the World Bank Group have pooled resources to identify and support global innovations to prevent gender violence in low and middle income countries. We received 300 proposals, 9 were selected, and today we will announce and celebrate the work of all of our awardees. Before I invite Jim Yong Kim, President of the World Bank, and Philippe Leroux, Executive Vice President and CEO of the International Finance Corporation, to provide opening remarks, I do have some housekeeping. Firstly, we will hear from the awardees shortly, but instead of having a Q&A session, we would like to invite everyone to join us for a reception after the event, where award winners will present posters on their work, and you will be able to ask any questions that you may have. Secondly, we are live streaming in both English and Spanish, and for those of you on social media, we are using the hashtags GBV Solutions and End Poverty. And finally, we also have simultaneous translation in English and Spanish if you need it, and one of our awardees will be speaking in Spanish. On this note, I would like to invite President Kim to the podium.
Thank you, Alessandra, and I want to commend you and the work of the Sexual Violence Research Initiative to help prevent violence against women and girls. Thank you and everyone who has been working in this area for your dedication and commitment. We're here to acknowledge, celebrate, and reward outstanding, courageous, and innovative work to prevent gender-based violence around the world. The award winners of the Development Marketplace for Innovation on Gender-Based Violence Prevention will each make important contributions to helping women have the opportunity to reach their full potential, no matter where they live. The World Bank Group Regional Vice Presidents will present the awards, and then we'll hear from the winners about their work to stop gender-based violence. Today is also a tribute, a solemn moment to remember the victims and survivors of this global epidemic. Like so many other global threats, gender-based violence recognizes no geographic or social boundaries. No one is immune from its impact, including members of the World Bank family. I'm deeply honored by the courage of the parents of Hannah Graham, Sue, and John, who are here with us today along with James. Can you stand, Jawed? The Graham family. Hannah tragically lost her life in 2014. In her name and in the name of all victims, we recommit ourselves today to end gender-based violence. We do this because gender-based violence is one of the greatest threats to human well-being and development in the world. More than 1 in 3 women will experience or has experienced violence in her lifetime. many times in her own home at the hands of a partner. This amounts to about 938 million women, or roughly the entire population of Africa. Gender-based violence is, quite literally, everybody's business. It exists in every region, every sector, and every socioeconomic stratum. Violence both expresses and reinforces deeply rooted gender inequalities. And inequality and violence impose costs no society can ignore on women, on children, families, communities, businesses, and whole economies. The costs include reduced productivity, increased healthcare costs, and harm to women and girls physically and psychologically, sending a message that they are worth less than boys and men. These costs amount to an estimated 3.7% of GDP in some economies. They set back our work to end extreme poverty by 2030 and boost shared prosperity of the bottom 40% of the populations in developing countries. The good news is that, as today's award winners have shown, violence against women and children can be prevented and survivors can heal. I'm personally invested in helping to achieve these goals. They're also priorities for the World Bank Group. In Brazil, for example, preventing gender-based violence has been part of our plans to help update and connect Rio de Janeiro's sprawling urban transport system, which we're supporting with a loan of $500 million. Stopping violence and helping victims is also integral to our work ahead. We have created a gender equality strategy, which was launched in December, and we've also put together a resource guide for World Bank staff to take action in their programs to address gender-based violence. The guide is based on the best practices from decades of work in this field. We're supporting innovation through internal initiatives like the Gender Innovation Labs and through partnerships like today's Development Marketplace. Today's award winners will receive grants of up to $150,000 for research and practical solutions or related activities that will contribute to preventing gender-based violence, including intimate partner violence and early and forced marriage in low and middle-income countries. Their work will have impact on developing countries globally, covering a wide spectrum of populations, from Syrian refugees to female sex workers. Tapping the creative energy of emerging leaders and innovative solution makers from all sectors will be critical to ending gender-based violence. We'll continue to look for new ways to support and expand on these efforts. We will not rest until all women everywhere are protected from violence and can live secure, safe, and productive lives. And I'm very happy to announce that the awards for innovation on gender-based violence prevention in memory of Hannah Graham will be repeated every single year that I'm at this institution, and I hope long after. Thank you very much. Thank you. Thank you. Now, it's my honor to hand over the podium to my colleague Philippe Leouerou from the CEO of IFC.
Thank you, Jim. Many thanks, and thanks to Alexandra and her team for organizing this event. Jim already said, gender-based violence is everybody's business. The Graham family tragedy is a reminder of its devastating reach. At IFC, we will always remember Hannah, and we work to stem this pandemic. As Jim said, also it is unacceptable that more than 1 in 3 women in the world experience violence in their lifetime. These figures has most likely increased, and that's bad news, in the past years. Large-scale migration has made women and girls even more vulnerable to sexual exploitation. Recent World Bank estimates suggest that 21% of refugee and displaced women have experienced sexual violence. We also see the effects of gender-based violence at the World Bank Group. When I was working in South Asia, and I have my colleague here now, women in our office express fear over the violence they encounter in public transport coming back and forth to work. Now, if you don't feel safe at home, if you don't feel safe at work, if you don't feel safe on public transport, you cannot be effective at work. Companies, and that's a good news, companies increasingly recognize this. So gender-based violence causes absenteeism amongst workers, so it's very real. And it causes them to be distracted on the job, it's obvious. And the cost of staff time, as Jim said, is quite high. The private sector can't afford to ignore it. We will work with our clients on this wherever and whenever we can. To give a practical illustration, in Papua New Guinea, for example, IFC is working with more than 40 companies on gender-based violence, prevention and reduction. The problem is urgent in the PNG. The UK's Overseas Development Institute estimates that over 2/3 of women in the country have suffered of some form of physical or sexual violence in their lifetime. Our work in PNG involves creating workspace policies that ensure companies' operations have been assessed and adjusted to limit the potential for gender violence. Some adjustments can be made quickly, such as displaying information on where employees can go to seek support or providing a phone line to call for counseling. But the harder work will be to change the mindsets by increasing education and reinforcing anti-violence messages. In IFC, we have worked with the private sector on stemming violence, but we are still learning what works. So we are identifying early results in the PNG and adapting what we learned there to our conflict-affected states in Africa program, CASA, that's an example. We also want to learn from others. We were just discussing with John about a program that is being piloted in Egypt on public transport and what we can learn from that and maybe start importing those good ideas and practices in IFC. But also the development marketplace for innovation on gender-based violence has an important role to play in this very, very hard work. I would like to congratulate the 9 winners of this award. Your innovation and commitment are crucial to our search for scalable solutions. So with your hard work, we can prevent gender-based violence for future generations. So thank you very much.
Thank you so much, Philip and President Kim. We are deeply honored by your presence, and we're deeply grateful for the World Bank Group's commitment to this issue. Now I would like to ask Hafiz Ghanem, World Bank Group Vice President for Middle East and North Africa region, to come to the microphone and present the first award.
Thank you very much. Dear colleagues and friends, I'm so pleased to be here today to present the first award to a team working in Lebanon, actually. And it's particularly important for me to present the award for the team working in Lebanon, since with Jim, our president, and with the Secretary General of the United Nations, we were in Lebanon just 2 weeks ago, and we were visiting with the Syrian refugees. And this is what this team is doing, is actually working with the Syrian refugees. So I'm very proud to have with us here Susan Bartels on behalf of Colin Davison, Noor Bakhash, Rida Anani, Annie Bonting, and Saja Michael. And this is a team that is working on marriage for young women and how to stop child marriage, which is an issue actually among the refugees, but it's also actually somebody who works in the Middle East and North Africa region. It is actually a more general problem. So please, Susan, come join me on the stage to accept your award.
Thank you, Hafiz. Now I would like to ask Victoria Kwakwa, World Bank Group Vice President for East Asia and Pacific region, to come to the microphone and present the award. Thank you.
Thank you very much. It's a pleasure to present this award to Michelle Decker, Dusita Puensamran, Surang Jamian, Chanrong Puengonyan. This group represents a collaboration between the Johns Hopkins University Bloomberg School of Public Health, the Thai NGO Swing, and Mahidol University. The work of the team looks at how to prevent and boost the safety, prevent violence against female sex workers, and boost the safety of this group. And this group is globally one of the most excluded and one of the most under-researched. The team's efforts look at the importance of empowering female sex workers by strengthening their skills and also by building their cohesion and strengthening their safety skills. They also place a lot of emphasis on the importance of community efforts in achieving this very important objective. I'm delighted to ask the team to come and receive their award. Congratulations. Congratulations. Chamron? Yes. Yeah. Congratulations. Dusita? Yes. Congratulations. And Surai? Congratulations. Thank you.
Thank you so much, Victoria. Now, could please Annette Dixon, World Bank Group Vice President for South Asia, come to the microphone and present the award.
I'm personally delighted to be here today to present the award to a team of researchers from Bangladesh. This team is comprised of Melissa Hidrobo and Shalini Roy from the International Food Policy Research Institute and Zahidul Hassan of the Data Analysis and Technical Assistance Bangladesh. Today, they're being recognized for their work to understand the effects of cash or food transfers combined with behavioral change communication on intimate partner violence using evidence from rural Bangladesh. Bangladesh, in many respects in the context of South Asia, has been a leader in closing gender gaps. They've achieved tremendous progress in girls in school, reducing maternal mortality rates, and increasing women's labour market participation. At the same time, child marriage rates remain persistently and exorbitantly high, and there are very high levels of gender-based violence reported. Between 53% and 62% of women in Bangladesh report experiencing violence in their lifetimes. Bangladesh has also been a leader in innovation and development, including in the area of conditional cash transfers. So this research will help to understand the world body of knowledge of understanding on how cash transfers can shape intra-household dynamics. While mounting evidence shows that cash transfers can potentially reduce intimate partner violence, much remains unknown about whether different types of transfers can lead to sustained reduction in violence. This team's work will break new ground by exploring potential pathways for reducing intimate partner violence. It promises to help inform policies and programs for optimal violence prevention in low and middle income countries. Please join me to accept your award. Thank you.
Thank you very much, Annette. Now I would like to invite Cyril Mueller, World Bank Group Vice President for Europe and Central Asia, to provide the award. Thank you.
Thank you. I'm very pleased to be here today to share with you two award-winning entries from the region of Europe and Central Asia. The first is a team from Moldova, which unfortunately could not join us today. So I'll go a little bit more into details of what they are, what their entry was about. The team is composed of Daniela Misael Nishitin of the International Center for Women's Rights Protection and Promotion, La Strada, Valentina Olaru of the Lucian Blaga Lyceum and State University, and Diana Ceanu of the NGO Center of Investigations and Consultation, Sociopolis. The International Center La Strada has developed a concept for a new year-long course that would be a school-based course that would be focusing on preventing violence. The winning team aims to fully develop and roll it out, then probably assess its impact. The most recent national survey in Moldova, conducted in 2011, found that 6 out of 10 Moldovan women had experienced at least one form of partner violence since the age of 15. While civil society, government, and other stakeholders are working to tackle gender-based violence, this team aims to fill a gap and to basically focus on primary prevention programs through education. I hope they're watching us on the web, since this event is today a webcast, and I congratulate them from here in Washington. The second award so you see, even Washington can reach Chisinau. The second award goes to a team from Turkey and represents a partnership among Women and Health Alliance International, the Relief Society for Syrian Refugees in Izmir, Harvard Medical School, and the London School of Hygiene and Tropical Medicine. And Jennifer Scott is here to represent the group. This team is recognized for its work to identify social, gender, and cultural norms underlying intimate partner violence among Syrian refugees in Izmir. Their work will inform an intervention aimed at preventing and reducing partner violence within vulnerable, forcibly displaced communities. Jennifer, please join me on stage to accept the award. They will probably want a picture here.
Thank you very much, Cyril. I would now like to invite Jorge Familiar, World Bank Group Vice President for Latin America, to come to the podium and present the next award.
Very good afternoon. I'm truly honored to be here today to recognize two teams from the Latin American Caribbean region. The first represents a collaboration between the Brazilian Interdisciplinary AIDS Association and the Regents University of California, San Diego, working in Brazil. Here to accept the award is Dr. Jamila Stockman. Dr. Stockman is representing her colleagues, Kiyomi Tsuyuki, Regina Maria Barbosa, Daniela Nautwil, who work together to identify factors that increase risk of intimate partner violence. Their study will further examine the intersection between intimate partner violence and HIV status in Brazil. More than 13 million women in Brazil are victims of intimate partner violence, despite having a law aimed at preventing such violence and prosecuting those who commit it. Studies show that Brazilian women do not yet access services after they are victimized. This collaboration will inform an intervention to prevent violence, connect victims to Brazil's healthcare system, facilitate access to the legal system, and possibly integrate violence prevention within HIV care services. The second award goes to Miguel Ramos and Nancy Palomino Ramirez from Peru, a country very dear for our president and for the World Bank since we had our annual meetings last year there. Working as part of Peru's Cayetano Heredia University. Their work aims at building evidence on how to effectively work with men to prevent violence against women. Their current work is grounded in understanding how harmful norms and attitudes that underlie the acceptability of violence against women are adopted by men, and how these norms may differ among generations. Once equipped with a deep understanding of these norms and attitudes, the team will create a curriculum aimed at men in 3 communities of Peru. The curriculum aims to build positive masculinities and work at the community level to prevent gender-based violence. Jamila Stockman, Miguel Ramos, Nancy Palomino, please join me on stage to accept your awards.
Sí, yo sé.
Many thanks, Jorge. And finally, I would like to invite Diarieto Gaye, World Bank Group Director for Uganda, Kenya, and Rwanda, to come to the podium and present the next award.
Thank you very much. And on behalf of the World Bank Group Vice President for Africa, Martha Diop, I'm very pleased to present 2 awards today. The first award goes to the team from Uganda, Jennifer Vragman of the University of California, San Diego, and Fred Nalugod of Rakai Health Science Program, who are here on behalf of their team, which also includes Paul Fleming, Gertrude Nazikozi, and Nima Nakianjo. This team is recognized for their work to design an intervention involving men and boys in preventing intimate partners' violence against women and girls in rural areas. Their effort built on 16 years of research by the Rakai Health Science Program to understand the epidemiology of intimate partner violence against Ugandan women and develop effective prevention interventions. The second award goes to a team from Kenya. Catherine Omenda is here representing a large team from World Vision. Their team aims to provide men who suffer from common mental health problems with cognitive behavioral therapy to explore whether this may prevent or reduce the incidence of violence. World Vision plans to add livelihood support and community messaging to provide provision of mental health care to reduce perpetration of gender-based violence. Sexual and intimate partner violence is often driven by factors such as economic stress and alcohol abuse. Untreated mental health problems can also contribute to sustained use of violence. Please join us on the stage. And I'm talking Jennifer, Fred, and Catherine, please. Thank you. See you, Jennifer. Oh, we need to take the picture. All right. Good. Fred, congratulations.
Thank you very much, Diarieto, and thank you to all of the World Bank Group regional vice presidents. Thank you to the World Bank Group for its leadership and for helping us advance our knowledge in how to prevent and respond to gender violence. We are very excited now that we'll get to hear from all of our awardees. As we heard, your work represents a broad range of practices, from testing the efficacy of prevention methods in different contexts, such as schools or households, to addressing the needs of groups in situations of greater vulnerability, such as refugees. Some of your initiatives will aim to advance our understanding about the linkages between gender violence and health issues, such as HIV/AIDS, and others will address particular risk factors among males to help us reduce gender violence. And we have another initiative that will help us understand how cash transfers can impact the level of gender violence in particular communities. My first question will go to my friend and colleague, Miguel Ramos. Miguel, you will work to understand how men in 2 different generations and in several locations across Peru will perceive gender-based violence. And you will then use this knowledge to design an initiative to change negative norms and attitudes. Why is understanding power imbalances and gender inequalities so key to help us prevent violence by men against women?
Muchas gracias.
Thank you. Good morning. It's an honor for me and for Nancy to be here and to receive this award from the World Bank. And we're lucky that the president of the World Bank also has traveled to our country. We always remember him. So now, to answer your question, from the time a newborn is identified as a male, society mobilizes in order to turn him into society expects from a male. A number of behaviors, actions, roles, and also beliefs. One of them is that anything that is masculine is superior to the feminine attributes, and in order to show that he's a male, that he's a man, he has to show that he has the ability to control and to develop authority and power over women. Otherwise, men feel humiliated, they do not feel that they're valued, and they will be a victim of social rejection. So since they're children, men must always show that they're men, as if that was a quality that is always about to be lost, an attribute that is about to be lost. And a way to show it is to have the ability to control women. And we learn that power over women is not something that cannot be changed. Rather, it can be lost. And in order to maintain that power, we have to always make use of that power. Otherwise, we will feel humiliated and we will feel that we're not being valued. So that's why it is important to think that in order to change, in order to stop violence against women, society as a whole should understand that men and women have equal rights, and they have to exercise their rights equally. And men should understand deeply that we have to renounce the exercise of power and authority. This is not just an individual effort. Institutions must change. They have to be at the service of women, and they have to ensure their rights. It's important to understand as well that society as a whole must change. We have to change this patriarchal system that continues justifying and worsening violence against women. We have to turn men into part of the solution, not just the problem. Thank you.
Your activities at World Vision Kenya also include a focus on men, particularly in the provision of mental health services. Additionally, you would like to explore whether adding community-level messages about gender violence for men will contribute to a measurable difference in the levels of gender violence. As you know, and as many of us know, the evidence shows us that programs that are multi-sectoral are often effective in reducing gender violence, and your proposed work seems to build on that knowledge. Can you tell us more about the program that you are designing?
Thank you. As she has said, in the study that World Vision Kenya recently did, we discovered quite a few things. One, the study was conducted amongst women who bear a disproportionate burden of sexual violence and physical assault in some cases. And this study for us was a bit disturbing because we realized that 50% of the women who were included in that study had experienced some form of sexual violence. And a further 75% of the women had experienced physical violence from intimate partners and from their spouses. And one thing that was common in this community is that 85% of these men were actually abusing alcohol. It is in an area, in an urban setting, where alcohol abuse is the most prevalent in Nairobi. So this begs the question of what can we do to focus on the group that actually perpetrates the violence, which is the men. So we're looking at this study in three ways to do for us three things. The first is the original study on the women proved a positive correlation between improving access to common mental health treatment, a common mental health treatment program. And this was so successful that 3 months post-intervention, they actually were still operating and functioning effectively. So we want to see if this will also be the same for the men. So we will be using community health volunteers to provide the same sort of treatment for the men, using fellow men to talk to the men in the community. It's low cost, it's effective, and it has been proven to work. Then secondly, we also want to look at the community messaging. Traditionally, this has been done by women and focusing on women and how to prevent or to protect themselves from sexual violence. But we want to spin this around and see what would be the effect of having men talk to other men about gender-based violence and whether this would have a corresponding effect on reducing the impact on the women. So this is something that we want to really study in this particular research that we're going to do. And lastly, we're looking at seeing if this is a model that can be scaled up. Because as we said, common mental health problems are actually have underlying causes like anxiety, depression, and even economic status of the men. So how are we going to build this in a sustainable model that the government can then come in and partner and build up so that we have a solution that can be not just used in that particular community, but that can be upskilled and used throughout the country. We hope that by having men speak to men, and talking to them about the issues that they are facing, we will have a movement that will enable us to really get to the root cause of the challenges. Thank you.
Thank you very much, Catherine. Now, I want to turn my attention to Jennifer Wagman and Fred. Jennifer, the Safe Homes and Respect for Everyone project in Uganda, which is known as SHARE, combines efforts to reduce partner violence and HIV infection and has shown some promising results in reducing experiences of physical and sexual assault among women. Can you tell us more about SHARE and the new model for engaging men and boys that you hope to build with some of the information that SHARE has already collected?
Yes, thank you. So from our past 16 years of work in Rakai, we know that women who experience physical, sexual, and or emotional partner violence are more likely to acquire HIV. And at the same time, we know women who are already infected with HIV are more likely to experience one or more of these types of violence. So the SHARE project that we conducted it implemented activities to address these overlapping health problems for women. Most of the work that we did was at the community level, and our aim was to try to raise awareness about violence between spouses and other intimate partners as a public health problem. We also worked to try to enhance the HIV services that are provided by the Rakhine Health Sciences Program. This program is the main provider of HIV testing, counseling, ART, and other treatment services throughout the district. And what we did specifically and briefly was try to incorporate screening for violence in all of our services, and to follow up with that to offer women who were in need adequate counseling services and other referrals. After 5 years of running the SHARE project, we saw very exciting and big drops in the types of physical and sexual violence that we were addressing. We also saw big declines in the number of new HIV cases throughout the community. What we did not see, however, is that men and boys were as actively engaged in our project as we had hoped. And this was a big challenge for a couple of reasons. One is that, like in many other settings, violence against women is often perceived as a problem just for women, despite the fact that it's men who are the most common perpetrators. And another big challenge in this setting that is not unique to this setting is that partner-level abuse is seen as very normative and common. And not only are men often condoned for violence against their partners, it's actually expected of men to beat their wives to show their dominance and power over women. And this is what we're hoping to address specifically with the support from the World Bank's project grant. And I'm going to hand over to my friend and longtime colleague, Fred Nalagoda, who's going to talk about what we're specifically planning to do.
Thank you. We know men are the perpetrators of violence against women, and involving them in prevention of intimate partner violence is very critical. We are going to look at our previous data that we've collected, focusing on men and boys who have reported incidents of intimate partner violence. And that data or information will inform us how to involve the men and the boys in prevention of intimate partner violence. Secondly, from this data, we'll design different strategies of how the men themselves would participate in preventing violence against women. Thank you.
Thank you so much, Jennifer and Fred. Let's now move on to an issue that's on everyone's minds: refugees, those who have been forcibly displaced by a humanitarian crisis. Susan Bartels, we know that women and girls who have been displaced face additional risks during displacement. Can you tell us about the gaps in our understanding of gender violence experienced by girls in displacement, and how your study will contribute to closing some of our gaps in knowledge?
Yes, thank you. Our team will look at the issue of child marriage, which is a serious human rights violation, a violation of the rights of children, and a common form of gender-based violence globally. We know that child marriage is increased amongst displaced Syrian girls, and we know that Syrian girls are being married at increasingly younger ages. Evidence has shown that when girls marry young, they tend to have children too young, and this places them at high risk of disability and death from complicated childbirth. When girls marry young, they are usually unable to continue their formal education, and this limits their future earning potential and their literacy. One of the gaps in our knowledge is understanding why child marriage is increased in humanitarian settings, such as the Syrian crisis. To help address this gap, we will use an innovative tool called Cognitive Edge's SenseMaker. SenseMaker asks individuals to tell a story about a topic of interest. In this case, the experiences of Syrian girls living in Lebanon. SenseMaker is based on the premise that storytelling is a natural way for people to convey complex information about their experiences. We will use SenseMaker to explore the societal, economic, security, religious, and psychosocial factors that are contributing to child marriage amongst Syrian refugees. We will take the SenseMaker results back to Syrian community members and support them to self-identify community-based strategies that are both acceptable and sustainable to address child marriage. Child marriage has profound implications for any girl, for her physical, psychological, and socioeconomic well-being. But it also has profound implications for her children, for her family, for her community, and for global development more broadly. Thank you.
Thank you very much, Susan. Jennifer Scott, you are also working with displaced Syrian women and girls, specifically on how to prevent partner violence amongst these populations. Why is it important for us to understand the norms that underlie partner violence within communities before designing interventions? And do you believe that there's a shift in norms and attitudes on gender violence that happens in the context of displacement?
Thank you for the question. As we've discussed today, intimate partner violence is one of the most common forms of violence against women. What that means for us in this room is that 1 in 3 women whom we know personally or whom we serve in our programs may experience violence in the places that they should feel most secure, such as their homes and in their relationships. We know it happens in communities at peace, and we know it happens in communities who are affected by conflict and affected by forced displacement. Intimate partner violence is probably the most common form of violence that women who are forcibly displaced may experience, but it is not the most common form of violence that we discuss in the media or in policy circles, and it should be. People are not talking about it, and I think it's difficult to talk about, and our project is focused on talking about it and breaking down some of those barriers. We're going to bring to light an issue that is usually kept traditionally in the homes and in families. Our project in Turkey addressing Syrian refugees will talk with women and with men, with community leaders and religious leaders to try to understand what is happening and why violence is occurring and how to prevent it. We would like to ask questions such as trying to understand how and in what ways a young woman from Syria may grow up and learn to tolerate violence. Similarly, we'd like to understand how a young man from Syria would learn to accept violence toward women. In order to inform and design and implement interventions and programs, we need to understand why this is happening. Our work will also try to understand how displacement impacts violence. What we know is that there are various norms, either from our culture, gender norms, religious norms, or social norms, that impact our behavior as human beings. When norms create and cultivate an environment where violence is tolerated and acceptable, when people are displaced and living under chronic stress, they will rely on what they know. And I think we're all here today to try to understand how to support peaceful and prosperous communities. And I think we first have to have peaceful and prosperous relationships and households in order to do that. And we are grateful for the support from the World Bank and from the Sexual Violence Research Initiative in order to conduct this work. So thank you very much.
Thank you very much, Jennifer. Melissa and Shanini, our understanding of the impacts of conditional and unconditional cash transfers on the levels of partner violence is still quite mixed. Would you say that we have enough evidence to increase our investments in cash transfers with the explicit objective of preventing gender violence? And how will your study provide us with some clarity on this issue?
Yes, thank you. Cash transfers have become a popular tool for decreasing poverty and improving human capital. These programs reach up to 1 billion people across Latin America, Asia, and Africa. And so it's very important for us to understand how these programs impact women's day-to-day lives and their relationships within the household. So there is a growing body of evidence that looks at cash transfers and their impacts on intimate partner violence, and it does in general show that cash transfers can reduce intimate partner violence. One potential pathway through which cash transfers reduce intimate partner violence is by reducing poverty-related stress. And so, for example, a study I conducted in Ecuador showed that day-to-day conflict was reduced as a result of the cash transfers from women not having to ask their husband for money to go buy food every day. A second pathway is that by targeting women, cash transfers may empower women and improve their status within the household. However, there's still a lot we don't know about cash transfers and intimate partner violence. Cash transfers are often combined with trainings, such as nutrition trainings, and conditions related to children's education and health. And so we cannot disentangle the impacts of cash transfer from these other components. Moreover, we still do not know enough about whether in specific contexts or subgroups, women might actually be put at risk from receiving cash, either because their husband might try to extract the cash from the woman, or because it might lead to male backlash. Lastly, most of the evidence to date comes from Latin America, and there's no studies on cash transfers and intimate partner violence coming from South Asia. So I'm going to pass it over to my colleague, Shalini, to talk specifically about our study.
Thank you. Our study contributes in a few ways to this evidence. First, the program that we look at has both transfer-only arms and combined transfer with child nutrition training arms. The intervention arms are randomly assigned, so we can separate out, for example, whether a transfer is enough for impacts on intimate partner violence, or whether you really need to include some sort of training along with it. Second, the study comes from a context where intimate partner violence is very high. About 60% of women in Bangladesh report experiencing it sometime in their lifetimes, but where gender norms are quite different from Latin America, where most of our current evidence comes from. For example, female seclusion, women staying within the home, is a strong sociocultural norm in rural South Asia. And so the specific pathway that Melissa mentioned found in Ecuador, women no longer needing to ask for money to buy food, would simply not be relevant in this context, because men are the ones who go to the market. Similarly, changes in female bargaining power arising from transfers going to women might also play out differently. I worked on a study in rural Bangladesh that showed that even when a transfer was specifically targeted to a woman, most dimensions of control, in fact, still went to her husband. And these patriarchal norms could, in fact, plausibly contribute to backlash as well. All of this is to say that context could very much change the impacts of transfers on intimate partner violence. And although cash transfers are a very promising tool for decreasing intimate partner violence, we really want to be cautious in extrapolating findings from one context to others with very different gender norms. Thank you.
Thank you so much, Shalini and Melissa. Thank you. Jamila Stockman, you are using a novel statistical technique to identify protective and risk factors among women who have experienced partner in my home country, Brazil, and the relationship that victimization has with HIV serious status. Can you tell us more about the innovative study and how you're going to use this data to inform a viable program in Brazil?
Yes, thank you for your question. So violence against women in Brazil is highly prevalent. HIV is also highly prevalent and intersects with violence. Specifically, HIV is both a cause and consequence of violence. In Brazil, approximately 97% of women living with HIV have also experienced violence, most often by their intimate partner. So clearly, addressing both violence against women and HIV is needed in Brazil. Our study is unique in that we will utilize an advanced statistical technique to characterize women's experiences with cumulative violence over the life course. So to do this, we have collected data via face-to-face interviews with HIV positive and HIV negative women recruited from health clinics in Sao Paulo and Porto Alegre, Brazil. Women were asked about their experiences with physical, sexual, and psychological violence. They were also asked who perpetrated the incident and when the incident occurred. So using these survey responses, we will characterize women's cumulative violence experiences through classification of severity of violence subgroups. We will take these violence, victimization, severity subgroups, and examine relationships between violence and individual and relationship characteristics, community factors, access to healthcare, and stigma. We will also examine differences by HIV serostatus. So our study is innovative in that we will be accounting for the actual time in which the violent incident occurred, as well as the different type of perpetrators involved in the incident. We will do this simultaneously. We will also be able to apply this in a context in which this has never been done before, Brazil. Findings of our study will allow us to develop programs that can intervene in multiple levels and multiple areas in Brazil. Some of these areas include changes at the policy, community, relationship, and individual levels. It is our hope that given Brazil's HIV specialized care system through their national healthcare system, we will also be able to develop programs around violence prevention that can be integrated to existing HIV care programs. Finally, our study can be replicated easily in other settings, provided comprehensive data is collected on violence victimization experiences over the life course among women. We hope that application of our study methodology will be applied in these different contexts that are culturally specific, and so that programs can be developed that are culturally relevant to the geographic region of focus. Thank you.
Thank you very much, Jamila. And finally, Michelle Decker. Your team's work involves the community to design an intervention that you hope will be successful in reducing violence against female sex workers. Can you explain how you engage the community and why this is an important part of the project?
Yeah, absolutely, thank you. So we've heard that sex workers are a population that is very likely to be excluded, right? And this makes engaging the community on this topic of violence prevention so very critical. We are just thrilled to be here in partnership with Swing. Our team has over 25 years of experience really working with sex workers, engaging them where they are on a variety of issues, health, HIV, and safety, really critically safety. So what a lot of people don't realize when they think about sex workers or the sex industry is truly the prevalence of violence. We often think about sexually transmitted infection and HIV, and those needs are great as well. And as we've heard, they're very related to violence. But the true prevalence of violence is really quite extraordinary for women that are trading sex. As we've learned, our team and others over the past 5 or 10 years of work in this area. Just to give you a couple of examples, I think the most striking one is probably the homicide rate. And studies have shown that the homicide rate for women in sex work is 17 times that of women in the general population. So that is a staggering difference, and it tells us that there are tremendous needs in this population. For those that survive other types of health issues, mental health, sexually transmitted infection, obviously including HIV, in fact, some of our modeling work has shown that we can actually prevent up to 25% of new HIV infections among sex workers by eliminating or reducing violence against them. So it tells us something about the gains that we can achieve by addressing violence in this population. So to bring it back to Thailand, which is the setting for our study, some of our more recent work has shown that up to 20% of female sex workers have experienced physical or sexual violence just in the week prior to our survey. So think about that. 1 in 3 women in their lifetime, as we've heard, 20% in the past week for this population. So really very critical. What adds some complexity is the perpetrators as well. So sex workers experience violence from intimate partners, certainly, but there's a whole host of other perpetrators, clients, police, strangers, others that are seeking to exploit somehow some power differentials here. So this adds some complexity for us. And in a sense, I will say as well that sex workers are, in a sense, really dually burdened. They're having a high prevalence of violence, but this violence is very often unheard. because of stigma, because of criminalization of sex work, these reports don't make it to police. They don't make it to the justice system. They're not able to access the health care that we know violence survivors need. And in a sense, they're very isolated and excluded oftentimes from traditional services. So our project is really designed to break this silence and break this isolation. We're going to be working with community outreach workers to really build a community response that both prevents violence through increasing safety, but also very much enables survivors of violence to access health and the justice system. So we're very excited about this. Obviously, working with an economically vulnerable population allows us the possibility to have a really tremendous impact. I mean, of course, we'll be building the evidence base on this as well. We want to understand what it will take to prevent violence and improve safety for women who trade sex, both in Thailand and, as you can imagine, hopefully globally, once we're able to find out what works and figure out how to scale it up. Thanks.
Thank you, Michelle, and thanks to all of you for really a fascinating discussion. On a personal level, I am so excited to watch the findings that you're going to come out with and how we might be able to apply these findings to other settings. And so I wish you all the best on your work, and I thank you. I thank you in particular for your tireless dedication to preventing gender-based violence across the globe once and for all. Can I please ask for a round of applause for all of our awardees? It is now my pleasure to hand the mic to the World Bank's Senior Director for Gender, Karen Groen, to see if you'll find awards for us. Thank you, Karen.
Thank you so much for coming today, and thank you so much to our award winners, and thank you, Alessandra, for wonderfully moderating this event. I think that while your work is really, really challenging, it has inspired all of us. We like to say that we're an evidence-based institution, and I think we are. And I think the awardees collectively are going to be gathering evidence to help us understand the causes of gender-based violence, but also actions to take for preventing it. We know far more about response and what works than we do about prevention. So I'm really hopeful that this first cohort of the development marketplace, and there will be several future cohorts, will begin to put together the evidence that we in the World Bank Group can actually use to incorporate in our programs, whether it's in a transport operation, whether it's in the health service, whether it's in cash transfers, or whatever, because this is an issue that demands action. It demands action now, and while we're waiting for the evidence for a few years, it's really important to continue to move. We can take action individually, and we can take action collectively. And individually, whether it's learning from the type of programs like Breakthrough in India, which is or witness bystander programs in terms of intervening, or more importantly, as importantly as our colleagues on this stage have said, to begin to name the issue, to talk about it, to be transparent about it, is so important. I'm sure all of us have lots of questions for our award recipients. I'd like to invite you to join them in the atrium just outside of the Preston on the other side of the globe. We have this incredible, it's like being back in grammar school and seeing a science fair. We have posters on the walls of all of their projects, and they're going to be standing there and doing a little bit of show and tell with you. So I hope you'll join them, take some lunch, and then engage in a discussion about what their work is, and learn more about what they're doing. So I'd like to close this event formally and say congratulations. We're so looking forward to bringing you back again and hearing how it actually evolved. Thank you again.